Well, the topic and the title now is a little bit different than it has been. We talk about new gals in town. AlphaGal is the one that's most well known, but her sister Anna, we're going to talk about this, which relates to the ANA test and what that might mean. I do enter to progress it, to advance the slide.
No.
So I was saying, Westminster Canterbury's had a lot to do with my experience with AlphaGal. The very first patient that I had actually presented in 2008, 49-year-old white female. I was consulted at the Baptist Hospital. She had a large area on her left arm, looked like a gigantic hive. And the question was, does she have lupus? Well, her ANA test was negative. And everyone felt like if your ANA test was negative, about 99% of the time you do not have lupus. So I felt comfortable she didn't. Must have some sort of allergic reaction. At that time, I didn't know AlphaGal existed. So lo and behold, about 5 years later, the same patient presents in my office, this time referred by the dermatologist with a biopsy of her skin lesion, which showed urticarial vasculitis. Urticarial is the hive-like reaction, of allergic reaction. Vasculitis, inflammation of blood vessels, is very common with some of the severe diseases of rheumatoid arthritis and rheumatology. But her ANA test was negative again. So the answer was, gee, no, she doesn't have lupus, still doesn't have lupus. But by that time I thought, this is sort of strange. And one of the people that was a real godfather of medicine in the 1960s, Eugene Stead, was one of our teachers and mentors at Duke. And Eugene Stead said that, when you went from the basement to the first floor with your patient, when you got to the first floor, you had a different patient, they had a different doctor. We're changing, hopefully we're learning things. And I thought, maybe this is some sort of unusual tick reaction. So I wanted to check, are you have exposure to ticks? Well, yes, you had exposure to ticks. Interesting. Any trouble eating meat? No meat intolerance. So I thought, well, I'm going to go ahead and check it. So I did, and her AlphaGal test came back at 14, very positive. Less than 0.35 was normal. That's actually been changed now. Less than 0.10 is normal. So this was a significant test. And so what do you do? My first patient with AlphaGal, she's not had any allergic reaction, how are we going to treat her? Well, I went ahead and had her get an EpiPen, just to have that on hand. And we talked about the mammalian meat restricted diet, wanted her to start restricting the diet. She was going to come back in about 2 weeks, but before she came back, she called the office. She said, I had a reaction. And I said, what, to what? And she said, potatoes. I said, well, that's crazy. That can't be. Well, her potatoes had been in a crock pot with pot roast, so it had plenty of exposure to meat. And that was the first person that I knew of with the idea of cross-contamination that you hear about and we worry about. When the doctor, Grace Newton, called for the consultation on her, we were all tied up. We didn't have any openings. But her mother was my patient. Her mother, who was a resident here at Westminster Canterbury, called, said, my daughter, isn't going to be seen for several weeks. Can you have her take my appointment next week? Sure, no problem. So we did. Well, then it got me started, thinking about Mom. I thought, well, they probably all had similar tick exposure. So the next time I had a chance to see her in the office, went ahead and checked her AlphaGal, and it was positive, like 3.18. It's significant. Again, no history of any meat reaction. But I think over the years, she and her daughter sort of drifted, like a lot of us, toward a little more away from beef, maybe, and more toward chicken and fish anyway. But so the mother had been followed with a chronic inflammatory arthritis that made us think that it had been treated like rheumatoid arthritis. It wasn't. Didn't have rheumatoid factors and didn't make the criteria for that. But she had an unusual rash and a chronic inflammatory arthritis. We treated her with methotrexate, Plaquenil, some courses of prednisone or steroids, and it took care of her arthritis quite well. So that was very interesting. Then later on, about in October of 2019, the patient's daughter had an exhibit here at Westminster of her art. She's an art student at William and Mary. And I thought, well, I came to see that, and lo and behold, as I expected, her mom was there. And in talking to her mother said, I can eat meat now. Nothing specific, but gradually she'd been able to get back and start eating meat. That's not atypical for the course of what happens in patients with AlphaGal disease. A lot of them just sort of spontaneously able to get back and start eating meat. So So from October 2013 to December 2014, I went ahead and took a look at AlphaGal test in lots of patients, probably 250 or 300, and 145 were positive. During that whole time, one patient we diagnosed with Lyme disease, 2 patients with ehrlichiosis, and 1 patient with Rocky Mountain spotted fever. Those are other tick-borne diseases. So without a doubt, the conclusion that AlphaGal is the most common tick-borne disease in our area, is for certain. I think we're going to find out it's going to be spreading, and would not be surprised eventually if it's not the most common tick-borne disease in the United States. This is also present in other places like Australia and so on. The patients, of my 145 patients, 28 of them had positive ANA test, this anti-nuclear antibody test, which is sort of interesting. Maybe 1 or 2 of them were diagnosed as to have definite lupus, but the others just had the positive test. And the traditional feeling in rheumatology at that time was this test is very sensitive, a lot of false positives, and if they don't meet criteria, they don't have lupus, you say, that test really doesn't mean anything. I think we're wrong. I think we're starting to realize we probably were wrong about that. The other thing is that this disease may present what we call protean manifestations, many different manifestations, whether it's rheumatologic, different types of arthritis, whether it's skin rashes, different rashes, the urticarial type rash being one, sometimes neurologic symptoms, even sciatica, paresthesias, pains, numbness, and tingling type symptoms in the extremities. And the gastrointestinal presentation is very common. Bob Richards in gastroenterology and his son, Dr. Nathan Richards, have looked at the AlphaGal in patients presenting with abdominal pain and diarrhea problems in their practice, which of course is tremendous. And they ended up finding I think last time I talked about 1,400 or so patients, and about 38% were positive for AlphaGal. Very common. I've tried to get them to go ahead now and find out whether they're having any other things like the arthritis symptoms, things like that might be other manifestations. So the mammalian meat allergy is not only not present in all patients, I think it's not present in the majority. I think it's just one manifestation of AlphaGal disease. You may be familiar with the story. I think we spoke about this before. You heard of cetuximab? The cetuximab story. That was where this was discovered. And cetuximab is a medicine which was being introduced for metastatic colon cancer, a biologic agent. As a biologic agent, part of its makeup was using some mouse antibody. And so this is what they were reacting to. And the people that normally would have a new medicine being introduced, this was particularly around Kentucky and Tennessee area, around the nation, about 1 or 2% were having allergic reactions to the cetuximab. But in these areas, Kentucky and Tennessee, about 23 or 24% were having this terrible reaction. And that's when Platts Mills and this group came and discovered that they were having the reaction because of an allergic response to the IgE antibodies that had developed to this sugar, the galactose alpha-1,3 galactose. That's AlphaGal. Most of the time the allergic reactions are to protein, not sugar. So this was very unusual. And again, for some time, they went through the idea that if you didn't have the severe mammalian meat reaction, allergic reaction, you didn't have alpha-gal tick disease. I think that's wrong. The importance of some of these diseases, too, are things that get started you may not realize, for some time. For instance, other infectious diseases, rheumatology, hepatitis B, hepatitis C. These patients may, years later, be bothered with terrible arthritis, inflammation in the blood vessels, cryoglobulinemia, and polyarteritis, all types of unusual sequelae. When these things are presenting, these infections are not something where it's caused by the infection. Their immune system's been turned on, they're having an autoimmune reaction that's sort of continuing to cause active inflammatory disease. So consequently, there's a study that they did at UVA, which was really important. They looked at 118 patients with cardiac catheterization, looking at them sequentially, and found that like 32% were positive alpha-gal, having no previous history of mammalian meat reaction. When they took a look at doing intravascular type studies to find out how extensive atherosclerosis was, they found out that these patients had more advanced atherosclerosis than the other patients in the cardiac cath that did not have alpha-gal. So the question was alpha-gal a risk factor for heart disease? Obviously, if it was, then alpha-gal had a systemic effect. It wasn't just an allergy. And if you take a look at all of the main inflammatory diseases in rheumatology, like lupus, rheumatoid arthritis, all of these folks have accelerated problems with atherosclerosis and heart disease. It's a common problem they have as far as the things that they end up having increased mortality from. And if any of you are under the care of the cardiologist, and they're always interested in the C-reactive protein, CRP, and they talk about it, they're very sensitive to CRP. Well, CRP is C-reactive protein, is one of the measures of inflammation. And I think in a lot of cases that there's an inflammatory nidus in the coronary arteries and so on that the atherosclerosis sort of settles in on. I think it tends to enhance the chances of you developing the atherosclerosis. The blood types are kind of interesting. The people with type B and AB blood types have less tendency for developing alpha-gal disease because the IgE, the galactose sugar, is similar in molecular structure to the people that they're B and AB blood types, so they tend not to react as much to it. But you find all sorts of different sensitivities, and we've had friends who remember going on vacation with them one time and going to this place, this fishing lodge, and the lady, she developed the alpha-gal first, her husband later on, would be explaining the stuff. And I mean, she had to know everything about different stuff that was in the food. And you could tell all the people who hadn't heard about this, was in Canada at that time, kind of looking at it like, you're just, really probably a crock, about all these dietary needs that you got. But lo and behold, they eventually realized this is all very true, and we're very, helpful in giving the right diet. Her problem has continued pretty severe for any kind of diet, dairy product, very actively responds to that. Some people will respond to little things like lipstick, any gel type of pill, gels are always made from animal products, so you try to avoid gel products. One of the patients reported that she always had a sort of a flare-up the afternoon after she had delivered Meals on Wheels, just being exposed, sort of not even ingesting or eating, but just being exposed to the atmosphere, I guess, of meat around. We got into treatment. It was interesting. There are a lot of recommendations that were sometimes misconstrued. One of the first recommendation was don't eat any four-legged animal. So immediately someone says, I have this pig. It's three-legged, lost a leg at the farm. No. And the other thing, as a matter of fact, this was in the New England Journal when they're talking about the increasing territory for the alpha-gal for the Lone Star tick. And they said, you have to worry about the red meat allergy, red meat allergy, red meat allergy. So the lady, of course, fixed pork, went to the emergency room with her reaction because it was the white meat, right? So no, don't do that. And then when I would try to counsel some of my hunters, the hunters would start off and they say, well, what about elk, bison, deer, rabbit, squirrel, bear? And I'd say, really? I said, mammal, 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 mammal. I said, do you remember your 9th grade biology? No. They skipped one hunting the day they went through mammals, I guess. But anyway, once you kind of get them convinced to use that and follow that diet, it does pretty well. The EpiPen, as you know, probably the most interesting thing about the EpiPen the last few years was the people that made it, West Virginia, tried to go ahead and run the price up ridiculously. It's not an expensive chemical or anything like that to make, but they did. And my wife was hiking the Appalachian Trail in sections with folks. And the most common cause of death on the Appalachian Trail is what, do you think?
Snake bite?
No, bee stings.
Bee stings?
And so we wanted all of them to have an EpiPen around, bee stings. And I was telling my wife, have a little syringe, and have her doctor give her a prescription for some epinephrine, just draw it up, have that ready to go. But I've never seen an EpiPen among her friends and hikers that haven't expired. That's better than nothing, I suppose. You hope something will get in, but you know, and I think a lot of times the expiration date is falsely advanced. And you have a handout there also on food allergy alert. And if you take a look at that, some of these things, I didn't even know what they were. For instance, dairy products, ghee, G-H-E-E. What's that?
It's an alternative to butter, no butter.
Okay.
Yeah.
But you can react to that. Chitlins are always an interesting thing. I had one of my sort of most distinguished physicians in Lynchburg, big outdoorsman, hunter and so on. He was elected president of the Chitlin Society and came in after their annual festival. He'd overdosed on chitlins, had a most incredible, amazing attack of gout. It wasn't AlphaGal, but it was gout. So chitlins, we say no, don't eat those either. Anybody eat chitlins?
Only once.
Once, yeah. And looking at the other things, I felt like this handout is from a meeting in Martinsville in August of 2019, and they had this on a nice little card, laminated card. Probably not a bad thing to have with you and carry with you. We could miniaturize that and maybe make some laminated cards of that. But I was thinking as when you call the restaurant and you say, now, you know, let me know if the foods are made with beef broth, gelatin, casein, whey, dairy products, go through all that, and then please take precautions to avoid the cross-contamination, change gloves, wash hands. After a while, they're going to say, you know, I don't think we got a room for you tonight. There's no tables. Why don't you go on down to the other restaurant on down the way? One of the real problems is in the fast food markets. And they say, I think somebody said it takes about, the orientation of the new fast food server and cooker is about 30 minutes. So the chances of them doing all this stuff to avoid cross-contamination gets slimmer as time goes by, I'm afraid. Have you all tried any of the Impossible Burger at Burger King? Impossible Burger made from soy, and I think that Hardee's was using the Beyond Meat burger made from pea plant. I've tried them. I thought they were quite good. Anyone else tried them? Not bad. But I think Hardee's may have discontinued it. It wasn't so popular. Then the question, if this becomes more frequent and more common as a disease, should we have a medical alert bracelet? And what would people know about it? I guess I'm trying to think, how would you figure out the medical alert thing? Just say, if I'm having a terrible reaction and I need epinephrine, or say, I may have AlphaGal disease. I'm afraid some of these, if you're looking at medical alerts, say, I have no idea what that means. But probably, I guess keeping the EpiPen or something like that around, have family or whoever you're around to kind of be aware that you make in a situation where you need that, could be life-saving. One of the things they're doing is, in Blacksburg, there's a company that has developed and cloned a AlphaGal null pig. And at this conference in Martinsville, the minute the people said that, everyone was saying, boy, next year we're going to have barbecue here instead of emu, which we had emu barbecue, and for lunch there. But what they're more interested in is like prosthetic valves, the pig porcine prosthetic valves. Some people with AlphaGal can have an immediate reaction on the table, very unusual, possible. However, in general, the porcine prosthetic valve, instead of lasting maybe 5 to 8 to 10 years, in these patients rarely lasts 2 years. So something, again, is going on with that disease that's still continuing. There's a continuing reaction going on, just like it is with maybe with atherosclerosis. Well, everyone asked eventually about the Solomon's auricular allergy treatment. You heard about that? This was being described to us by Dr. Liebel in Virginia Beach, who's an acupuncturist, chiropractor. He's written a book on this. And this is a procedure that you don't get a study for. And in it, it's the idea of putting tiny little pins up here in different areas of the ear, which presumably take care of allergies, allergic reactions. Now, when he started talking about this, a lot of us got up and sort of left. Not because, it wasn't of interest, but he started off, instead of just sort of presenting his stuff, he was really disparaging everything, about all the classic stuff. We thought, if you really got the goods, you don't have to do that. So we kind of left, and I certainly had no predisposed interest in that. However, when I got back and started to do some talks on AlphaGal, people were asking about it, and several people came up who I consider very solid folks, very well studied, well thought of, thinking through things. And they said, well, I started that test, that treatment, and 2 weeks later I was eating bacon, not turkey bacon, but real bacon. And I thought, well, that's interesting, no doubt about it. And years ago, Mike Valentine, a cardiologist, an electrophysiology cardiologist, they were just checking some different cardiac medicines as antiarrhythmic agents. And they were doing all sorts of fancy testing, microsecond types, evaluation of the QT interval and different parts of it, and other ways to kind of prove which one were the most effective anti-arrhythmic agents. Finally, since after doing all of these special testing, we realized that at the end, all we had to do was say, well, in brand X and brand Y, which one didn't have more patients alive at the end of the study? But that's not a bad way to do it. That's kind of what you're interested in. Likewise with this, the thing that gets people back to eating meat, that's pretty interesting to me. So I'm not going to talk about and dissuade anybody. This is something that I don't think is dangerous. Don't see how it could work. I think you could have some proof in that most of the time as patients are getting better with AlphaGal, if you look at their specific titers for pork, venison, and beef, those titers start to come down if you retest them. So we ought to see with the Solomon's auricular allergy treatment, we ought to see those titers coming down. One of the physicians who was what we call a the doctor's doctor, someone that, if one of your family members is having gastrointestinal problems, you want Mike McLeod to see him. He had patients coming from all over the Southeast. And usually when he came in to do, we're talking in the late 60s, early 70s, they were just getting started on endoscopy. So he came into Duke with sort of mysterious pains and what they call the black box, the belly. You got all sorts of GI studies, barometric, upper GI, small bowel follow through. And you had the rigid endoscopies looking at the esophagus and the stomach. It was a significant workup over a week or two, all kinds of blood tests. Usually all the final tests were not back by the time the patient went home. And they would come back in a couple of weeks. And very often Dr. McLeod would go through all these tests and he'd say, there's just nothing we're finding that's abnormal on your test. And, so it's good you don't have, any terrible cancer or anything like that. And we're not sure why you're having that pain. And a lot of times the patients went home. And one time, about 2 weeks later, I got a letter from the patient. She said, Dr. McLeod, I appreciate that. Went through that really expensive workup to do. You didn't find anything. And my friend down the street said, well, why don't you go to my chiropractor? And I went to the chiropractor, and after one treatment, my belly pain's gone. Why didn't you, instead of just have that expensive treatment, why didn't you recommend that? Well, Mike McLeod, sometimes physicians have egos, amazingly enough. And instead of firing off a letter like, that's a bunch of baloney, instead Mike McLeod thought about it. And then after that, when somebody would come in and you go through that whole workup, the same type of explanation, he said, have you thought about seeing a chiropractor? So, and then after that, you get these letters back, 2 weeks later, say, you were so smart. Thank goodness you were smart enough to send me to a chiropractor after all that great workup. So I thought that was kind of nice. I think there's a lesson there. So I'm not going to, disparage anything until we have, more evidence. And when I have, friends of mine and good solid citizens come up and say, these little, needles in my ear have helped.
Oh, yeah.
Interesting.
Yeah.
But one thing for sure, I think in the treatment now, because of the advanced atherosclerosis, I think you'd like to go ahead and take care of the other cardiac risk factors that you know of. If you're hypertensive, if you have high cholesterol, diabetes, obesity, tendencies like that, go ahead and pay attention to those. My friend who was recently diagnosed with the aches and pains up in Charlottesville by the primary doctor, his wife is followed by Platts Mills for her AlphaGal disease. And when she was there the last time, all he kept talking about was about the cholesterol, making sure she was getting that taken care of and watching that. So I think they really believe this, is a systemic disease that, can advance and have more progressive and early atherosclerotic problems. Interesting. If you're going to sort of, directly take care of the problem, of course, hopefully, keep the ticks off of you, avoiding ticks, tick repellents, different clothes. When you go out gardening, my wife is a real tick magnet, and before we moved in here, she'd go outside and somehow we just run out all here, run out here, run out there, and never would she put down the repellent, clothes, stick pants down in her socks, any of that kind of stuff. And so I'm just amazed she hadn't had AlphaGal. But I think people have different predispositions to catch these different diseases as well. We're going to talk about some of those predispositions. And then indirect problems that are occurring. What's happened to the deer population? Well, once they leash the dogs excuse me. That's right up my microphone. Sorry. Well, these folks, say Sandra would wake up in the middle of the night, she'd say, I feel a tick, and she always had all those tiny little, ticks, and sometimes the reaction around those, you ever had one of a small tick bite, you get a tremendous reaction, some people do. She reacted greatly, never got AlphaGal, always sort of surprised. But again, once they put the dogs on leashes, the deer said, well, it's safe to move on into town, and they did. My goodness, our gardens were just feeding centers. And with global warming, there's, again, the tick territories are moving up, and I think there are less of them that are being killed through the winter. And how do y'all remove a tick if you get it?
Carefully.
Huh?
Carefully.
No, you use a credit card and scrape.
Oh, that's good. I like that. I don't know if there's, well, I know it's different things, yeah. We had to think about, put a match to them,
No.
and then they're gonna withdraw. No, match them, they're holding on to their, as they're dying, probably, give them a better bite. Freeze them, skin them refrigerant.
Oh.
Yeah, I don't know. We end up, just getting as far close as we can with small tweezers and pulling them out. Then put some stuff on there. When you think about as kids, did you have any tick problems? You remember? And gee whiz, I can't hardly remember ever having it. Particular dogs had ticks, and so they were around. They didn't get to us at all. So I'm always interested. I find more and more ways that people are removing ticks. And there's the tick of note, Lone Star tick, easy to see. Lone Star tick, every phase of the Lone Star tick can carry the infection, whether it's the larva, pupa, the smallest, or the adults. And if you notice, what's the difference between this and an insect? Because this is an arthropod. 8 legs instead of 6. Insects have 6 legs, and the first 2 legs in the Lone Star tick have CO2 sensors, carbon dioxide. And so when you're out, out in the yard or something like that, and you're breathing CO2 and it's hot and so on, the sensors say, let's go get this person. And they describe folks, where ticks were seen dropping off the trees in response to the CO2, and they're very fast. Our friends who have probably the most tick-infested AlphaGal problems, we went to their house one night, and we're all sitting outside eating, and gee whiz, everybody was taking ticks off. It was, and so you spray in your yard, all those sort of things make sense to me. A recent thing that came up, which has great interest, particularly from a rheumatology standpoint, is the page you're going to see there on some of the genetics of this. And the Arthritis and Rheumatism is our major journal. And they had an article talking about the increasing prevalence of autoimmune diseases. We're talking about lupus, all sorts of thyroid diseases, more and more autoimmune diseases. What triggers and why are we seeing that? And they felt that an indication that we were having more autoimmune diseases was looking at the increased prevalence of ANAs. And the ANAs, in a nice study that was done, showed that in 1999 to 2004, prevalence was like 11.5%. In 2011 to 2012, it was almost 16%. They see this increasing prevalence, they think is significant, correlating with increased autoimmune diseases. If you think about an anti-nuclear antibody, these are antibodies that are made against your nucleus, your nuclear material. And that's can't be good, it's just not a good thing to occur. All these autoimmune or autoantibodies seem to get worse as time goes by. People say if we live long enough, we'd all have a positive rheumatoid factor, another anti-antibody. Rheumatoid factor is a type of IgM antibody against your IgG antibodies. So you make an anti-antibody. And you talk about autoimmune, my goodness.
Wow.
So with this, we thought that's certainly of interest. And my group, which was then in 2014, so a couple of years after their last, once this study looked at, was about 18.9% prevalence. So it certainly is increasing. And they attribute this again to the increased number of ticks, the increased territory. And we talk about when we're born, we have among our inherited genetics certain susceptibilities things we're susceptible to by genetics. In the past, most of this was covered with the question of what runs in your family, and that gave us a tip-off. But those inherited susceptibilities, the question is what makes them be expressed. We start off there unexpressed. And if you take a look on your handout on the genetic part, we list several ones. And for instance, on the right side is the AlphaGal situation. And the AlphaGal, probably the inherited susceptibility that is unexpressed that people have is a gene deletion of a particular gene, alpha-1,3 galactosyltransferase, which allows you to make AlphaGal. So the humans and the old world monkeys were the two things that did not have AlphaGal. And the reason is probably it was an evolutionary advantage somewhere in the past not to have. It's kind of like sickle cell. Sickle cell in the blacks probably sometime in Africa was a selective advantage in the face of malaria. They were less susceptible to malaria. So somehow this was an advantage. Doesn't seem like much advantage now, but think about it. Here you have this deficiency all your life, and yet you're eating meat, having no problem. So it's not until you get the trigger that occurs, and the direct trigger is the tick bite. Transmitting that and getting you start to make antibodies to the sugar, and the next time you get hit, you get sensitized and you start to have the reactions. You have the AlphaGal tick disease. And the idea of these genetics, these studies, and the way they do that's most interesting is GWAS, genome-wide associated studies. And thanks to Francis Collins, who really perfected this years ago, you can take a look at a group of people with, say, alpha-gal disease or COVID disease, and take a look at their genome-wide association. You find different sets of people that have things that correlate with different aspects, different diseases. So within the alpha-gal, You then say, if we can predict that this person is going to be as evolved as are, we have the susceptibility to this disease, what can we do to prevent it? And we say the first thing is the tick avoidance. And another thing is to try to handle and prevent the indirect trigger of it, which is global warming. If you take a look at COVID-19, which is in the center part here, what they found out is that people that are type A blood type and people that have this particular locus on this genome map, genetic map of their inheritance, that have this one locus, this multi-gene locus, 3p21.31, that the people that have these two things together are the ones who are going to, if it's hit by the virus as a direct trigger, are going to have more severe disease. They're the ones who are going to be, having a hyperimmune reaction, which is a true autoimmune reaction, where the body responds and they get into things called cytokine storms, and they end up with greater morbidity and mortality. So if you know this select population, they're the ones that you want to try to prevent first before you get the disease, using the mask, the social distancing, and vitamin D, and obviously they're the ones that should be vaccinated. If there's any priority to vaccination, this group would be it. If you don't get to them until after they're infected, but you still know they're in this group, then you say they're the ones who want to use dexamethasone sooner, not later. And they're the ones who want to have the monoclonal antibody plasma. We really got the most interesting initial study which talked about inherited susceptibilities, things that you're born with, was this HLA-B27 story. The thing that's interesting is that Jim Hunter, who's here, was in the Navy at the time this took place, and knew the person that was involved with this. Fascinating story. HLA-B27 is one of the histocompatibility markers about having to do with people's compatibility for transplantation. And some people have similar HLA-B27, they look at A, B, C, and D, similar, findings on those. They're more likely to be able to accept organs and transplant organs back and forth. But the people with HLA-B27 was about 5 to 7% of our population. I thought that was interesting. Well, what happened in the Navy in 1964, before they didn't do anything about HLA, they had an outbreak of dysentery on a Navy ship, a cruiser. And the 1,200 men there on a cruiser, about 600 got this diarrhea illness. That's not unusual, and usually in about 4 or 5 days, most of them were over that, which is common. There were 12 of them that started to develop a persistent inflammatory condition called Reiter syndrome, where they had arthritis, urethritis, inflammation in the urinary tract, conjunctivitis, inflammation of the eyes. And so he wrote this up, a guy named Noer, N-O-E-R, and that was sort of of great interest to us. So here was an infection that triggered off a great chronic arthritis problem. But then in 1972, two of the great researchers in rheumatology, Fries and Kalin, did an article called Revisiting this Shigella outbreak. By now, HLA typing was present. The Navy is always good about keeping medical records, so they were able to track down these people that had this reaction, the Reiter syndrome after the dysentery, and they were all positive for HLA-B27. If you look at it from the other standpoint, you say if someone is born with this and have no illnesses or so on, what's the likelihood of having a problem? Well, about 20% later on will develop some problem, according to when they get this susceptibility triggered off, to go from a susceptibility that's unexpressed to one that is then expressed. So this is a real model for disease, and the importance of this is to say, okay, we can predict these people are going to have this, so how do we prevent it? And one of the things that was interesting in the ANA test, I can't tell you how often in rheumatology you would get a consultation. This patient with positive ANA, do they have lupus or anything going on? And again, you say, they don't have criteria, don't fit criteria. But in some of our patients, if they're a little bit suspicious, and I'd say, this patient, she doesn't really have all the features of lupus, but maybe she has Raynaud's. Maybe she's had an episode of pleurisy or pericarditis in the past. A little more suspicious. These folks, first of all, and all my folks, we got their vitamin D up. These people almost always, some had very low vitamin D. In addition to the vitamin D, we put them on Plaquenil, hydroxychloroquine. Remember hearing about that when they started with all this COVID stuff? And had no basis for using it for that, and indeed had no basis to help with COVID-19. But my patients over 6 months to a year or two found out that the vitamin D and the Plaquenil, hydroxychloroquine, that their ANA was going away. Well, the ANA, when it's positive, you say very sensitive, a lot of false positives. Boy, that's negative, that's negative. I thought, are we doing something to really prevent this stuff from occurring? And we talk about immunomodulation, and that's one of the advantages. We think, every one of these COVID-19 severe cases were vitamin D deficient. And if you take that, can that keep the COVID from firing off your autoimmune hyperinflammatory response? So things that I think are very interesting right now. What I predict is going to happen in our, maybe it may not be until it's our great-grandkids, but when the child is born, I think they're going to do the genome map of the individual. And say, this individual has this genetic focus, has this HLA-B27, has this and this. We know that this person, in the future may have been really susceptible to problems with the COVID thing, with Shigella. We're going to give this person vaccines for these different things so they never get it, or at least decrease the chance of them getting it. Or we're going to say, now, this person we know really needs to avoid excessive sun exposure and other type of environmental triggers. We're very interested in environmental triggers, global warming, chemicals. Agent Orange, I think, has caused a lot of autoimmune diseases. The government will not buy that. They've accepted the fact it's caused lymphoma. Lymphomas and some of these diseases are very much kind of related, very, very, very close. So those are things that kind of excite you, from a oncology standpoint. But now I just want to open up to any of the other questions about AlphaGal or genetics.
How long does the rash last, and is it usually located in just a certain area?
With the AlphaGal or?
With the AlphaGal?
No certain area, and there are a bunch of different types of rashes that can occur with that. Say psoriasiform is what my lady here, the mother of JG, had. Hers just like a little bit on the fingers. Urticarial type rash and urticarial vasculitis, can be like hives all over the place. Interesting thing I had. Is that us? No. One of my patients had, a young man came in and was sent over, and he had angioedema, which is diffuse swelling to the hands. And in addition to AlphaGal, he was vitamin C deficient. Interesting. At the time this article came out, where the Dr. Bukala, who's the associate editor for arthritis and rheumatism and academic rheumatology at Yale, came out with this stuff about AlphaGal. I sent him the information I had from my patients, got a nice letter back, and they're going to be looking at some of these things. But the possible association of these autoimmune diseases, are so interesting and so important that again, we're kind of excited about that. But those different rashes. At that time, I'd seen a patient in the free clinic who said same thing, except for ANA positive. Does she have, lupus? No, she didn't. She was AlphaGal positive, and she had her ANA again was significant. Then I got a call in Eastern North Carolina from some of my best friends there about their son-in-law. Now, this thing is really important because son-in-law was having spells. He's about 47, 48 years old, and he would just sort of fall out of work, very, very weak. And they quite appropriately, they'd seen a cardiologist. Cardiologist for a young person had done the heart monitoring, had no arrhythmia. They had to see the neurologist. The neurologist thought that maybe he was having small seizure-type activity, put him on an anticonvulsant-type medicine, didn't tolerate it well, but he was taking it. Spells continued. I only knew one thing about this fellow. He's in Eastern North Carolina, and guess what? Cliff's a hunter. And I said, Carmen talked to his wife and said, any definite meat allergy type reaction? No, he loves meat, eats meat all the time. No, okay. Take him to his primary doctor anyway and say, go ahead and check AlphaGal and check an ANA too. And so they went to that primary doctor and got the same response that my friend got up at UVA. We haven't had any terrible allergies. You're not going to have that. We don't need to check that. But to humor Cliff's wife, Carmen, is a force. And thank goodness. As you know, the women have to always get in and push the men through most of all these medical things. So they got the test done, both positive, AlphaGal and ANA. So he stuck out on us mammalian meat. What was happening was Cliff, his fallout spells, he was on his way to anaphylactic shock. And I said, well, Carmen, when he falls down, what happens to his blood pressure? Blood pressure keeps going down. And I said, what about his pulse? You expect the pulse to go up. It wasn't going up. A little trouble breathing. So he was probably about this close for a quick trip to the ER, for epinephrine. But things settled down for Cliff with these episodes. Once he got going on the diet, less and less frequent episodes. So I talked to Cliff. Same old question, anything, and Carmen said, Cliff's sister has AlphaGal. Isn't that interesting? And Cliff have any other problems? Cliff's had a little thyroid problem. His sister does too. Autoimmune thyroid disease, both of them have positive ANAs. So now the next thing I've got to do is to convince the doctors, to check the AlphaGal and the ANA. That's going to be hard to do for some reason. I'm not sure why, but why would you be curious about that? It opens the possibility to really prevent some significant disease and some interesting correlations, I think.
I'm sorry, I missed the connection between AlphaGal and ANA.
It's the fact that AlphaGal is probably increasing because of indirect influence of global warming, increasing numbers of ticks, increasing deer and turkey that carry the ticks and so on. And it's increased in sort of at the same time that increased prevalence of autoimmune diseases occurring, which I think is reflected, with an ANA. So I think that some people probably have both these things, the tendency to both of them at the same time. And I sure would like to see them check one more. Yeah.
So is there always a tick bite associated with AlphaGal, or and at what point, like if you had a tick bite when you were in your early 30s and then in your 60s and 70s you come down with AlphaGal, would they associate it with the bite?
Well, not the one 30 years ago, I don't think. I think they haven't had any reaction. But the other thing is most of the time they talk about people who have the bite have a really big reaction and a really strong reaction, then develop AlphaGal. I'm not sure that's true. But one thing, my orthopedist, his daughter has AlphaGal, and he's sure, and actually Platt Mills in one of his episodes raised the same question, and that was chiggers. Tremendous reaction. You ever got a good case of chiggers? Wow, you're talking about having your body react, and if you say something that's really shocked your immune system, triggering off maybe some autoimmune stuff, I think that could do it. So the other thing is some ticks can carry several different diseases. I think there's just a lot we don't know about the basic thing there. My feeling about ticks is sort of like my feeling about snakes. I'm not crazy about any of them. None of them I say, oh, that's a good tick, that's a good snake. I like to avoid both.
Yeah.
I know that I love tenderloin. That's the only beef, but I like lamb and pork and bacon, of course. And before I came to Westminster, Canterbury, I was a great gardener. I spent a lot of time outside. I know I got tick bite after tick bite after tick bite. And I would get my tweezers and carefully pull them off, and I was fine. A year after I got here, I got the symptoms for AlphaGal. Now, that year after that I was here, I know I didn't get any ticks. So there is quite a lag time.
Yeah.
Have they isolated the actual agent in the tick saliva? Do they know exactly?
See, that's a really good question, because a lot of people wonder if there's something that's acting as an adjuvant with the AlphaGal the sugar itself. That continues to be looked at. I'd say that no one is 100% sure. And why, it's more the Lone Star tick than others. Don't know.
Well, are they sure about the Lone Star tick being the only vector?
Oh no, I think they feel like others can carry it too. Particularly, I think there's like 3 different ones in Australia that may carry it. The tick diseases, the viral diseases, bacterial, parasitic, and so on. In rheumatology, that's the other thing as far as models of disease. You say, well, here's an allergic type reaction. Is there any episodes where people start with allergic type things and later on develop into persistent autoimmune type reaction things? And there are this thing called Church-Strauss vasculitis, where people start off with 80 or 90% of them have history of asthma, reactions like that. And then years later, they develop this systemic inflammatory vasculitis. And at that time, when it's a systemic inflammatory vasculitis, it's quite a significant disease, and they really have to treat it pretty strongly.
Is it known where the ticks got the source of this?
I beg your pardon?
Is it known where the source of the AlphaGal came from? I mean, how did the ticks acquire this?
Well, everybody, the tick, bites a deer that's a mammal, and so he gets, part of the AlphaGal that way, or likewise bites a turkey. Turkey and deer are great carriers of the ticks to attract the ticks. So that's probably where they get it. Or from other, any other animals. I think the fascinating thing is that the humans and old world monkeys, didn't have it, but the new world monkeys, have AlphaGal. You need a new world monkey, old world monkey.
You mentioned the EpiPen. I got one when I was diagnosed, and it was $40. And then I noticed that there's a date on it. So when the year was up, I thought, well, maybe I'd better get another one. And it was $400 in 1 year. That's the price change.
In one place, they were $600.
Yeah.
How really? Well, it's only one place that was making them too. That was in West Virginia. And I thought that was really quite an embarrassment. I'm sorry that.
Well, I did not get one.
Any other question? I'm sorry, excuse that thing.
You were talking about that some people show their symptoms are joint pain and this
Yes.
type of thing.
Yeah,
Can it be like AlphaGal?
I'm sorry.
I can eat grass-fed beef with no problem, but if I eat beef that's fed other than grass-fed, I will get joint pain. Bingo. I drop the meat and I'm fine. Can that be like AlphaGal?
I think so. I think it'd be possible.
Have you ever been tested?
No, never thought about it.
Okay.
Well, and, you might say, well, if somebody is not having, reaction much to food, and like my friend, who had his aches and pains in the joints, and got them to check, and you say, well, then why worry about it? Well, if you're not having reaction, well, because maybe you're having accelerated atherosclerosis,
Yeah.
premature heart problems, heart disease. And the other thing is, if you know people that had Lyme disease, the big question has always been chronic Lyme disease. And my infectious disease friends kind of look askance, saying, here this person is still having a lot of symptoms, had Lyme disease, they may have chronic Lyme disease. Oh no, if you doxycycline, take that, if they have that, they don't have Lyme disease. Well, I think that's wrong. I think this is exactly the same thing where some people, once the autoimmune thing is stirred up, they'll go ahead and have a chronic ongoing process. And just like my first patient's mother, she was having a chronic inflammatory arthritis, had to treat like rheumatoid arthritis, but I think it probably was started with AlphaGal.
Any other further questions?
Yeah, I do.
Okay.
You mentioned something about gel products. Are you referring to pills that are
Yeah.
in a gel and Jell-O and stuff like that?
All the gels, have a mammal meat base. And some people are sensitive to that. And then your vitamin D2, the prescription vitamin D is lanolin based, so it's an animal product. Some people respond to that. Some people, heparin flushes, think how often you have a heparin flush. Some people who have an anaphylactic reaction to that with AlphaGal. Those people are the ones that are super sensitive, super reactive, and most of the time we just see such a variety. I bet you that eventually they'll have the genome set and they're going to say, okay, here are the AlphaGal folks that have this genetic locus. They're going to have more problem with a severe allergic reaction versus these other folks who maybe have more GI symptoms. These other folks have more arthritis symptoms. Maybe they give clues to more specific treatments.
Thank you very much, Jeff. Very, very